What happens to your body after taking a dose of ibuprofen? Whether it's toothache, headache, or menstrual pain, why does ibuprofen seem to accurately target the pain in your body? Let's uncover the secrets of ibuprofen. The moment ibuprofen enters your mouth, your tongue won't taste anything. That's because ibuprofen is coated with a special outer shell. When you swallow ibuprofen with water, the stomach is the first organ to interact with it. Gastric acid surrounds and begins breaking down ibuprofen. What's broken down first is the outer coating of the pill, which protects the active ingredients from dissolving prematurely. This ensures ibuprofen is only activated in the stomach. However, the process of breaking down ibuprofen isn't instantaneous. It takes about 15 to 20 minutes for the stomach acid to dissolve the coating. Once broken down, the active pain-relieving molecules are released. These molecules then travel from the stomach to the small intestine. In the small intestine, ibuprofen doesn't act immediately. After passing through the winding pathways of the intestine, the molecules reach the liver, the body's main detoxification organ. Here, the pain-relieving molecules face their first test. Enzymes in the liver, such as cytochrome P450, process and filter the molecules. Weaker molecules are metabolized and excreted, while stronger, active molecules successfully pass through. After leaving the liver, ibuprofen enters the circulatory system. The bloodstream acts as a highway, delivering the active molecules throughout the body to locate the source of pain. Blood vessels are densely distributed across the body, totaling over 96,000 kilometers in length, enough to circle the Earth twice. Riding the bloodstream, the pain-relieving molecules search for the source of discomfort. Ibuprofen doesn't know where the pain is. Instead, it moves throughout the body, checking each area systematically. This process is why ibuprofen doesn't act immediately and may take 1 to 2 hours to fully relieve pain. Ibuprofen is a slow-release medication, designed to release its active ingredients gradually. This slow process helps reduce side effects, stabilize drug concentration in the blood, and prolong its effectiveness. When ibuprofen reaches the pain source, it doesn't act directly on the affected organ. Instead, it targets substances responsible for transmitting pain signals. For example, in the case of menstrual pain, ibuprofen works by inhibiting prostaglandins, compounds that promote inflammation and pain. It specifically blocks the enzyme cyclooxygenase, COX, which is necessary for prostaglandin production. By reducing prostaglandins, the sensation of pain gradually subsides. As the pain lessens, the concentration of ibuprofen in the blood also decreases. However, the remaining ibuprofen molecules don't disappear instantly. They are eventually carried back to the liver, where they are further metabolized and broken down. The metabolites are then excreted through urine. There are several important things to know about ibuprofen. 1. Ibuprofen is not addictive. Contrary to rumors, ibuprofen doesn't contain any addictive substances. Fears of dependency are usually psychological, as some people worry they might rely on ibuprofen for pain relief. It's important to take ibuprofen when needed, and not endure unnecessary pain. 2. Ibuprofen doesn't cure underlying illnesses. It's a pain relief and anti-inflammatory drug, not a cure. Using ibuprofen to address symptoms without treating the root cause of the pain is not advisable. 3. Excessive ibuprofen use can lead to tolerance and side effects. Frequent use can cause the body to develop tolerance, requiring higher doses for the same effect. It can also harm the liver and kidneys. Occasional use, such as once a month, is unlikely to cause such issues. 4. Ibuprofen can be used for various types of pain. It's effective for joint pain, toothache, neuralgia, headaches, or fever-related discomfort. 5. Ibuprofen is for adults. Children should not take ibuprofen as it can irritate their gastrointestinal tract, causing nausea, vomiting, or abdominal pain. 6. Avoid alcohol while taking ibuprofen. Mixing alcohol with ibuprofen can increase the risk of adverse reactions, including nausea, vomiting, or, in severe cases, gastric bleeding. What are your thoughts on ibuprofen? Share them in the comments, and let's discuss together.